Hi guys, how we doing? This is Greg from the YouTube channel Growing Older Gratefully. This is day 2 of my journey of having hip replacement surgery, and as a matter of fact, day 2 was actually the day of surgery. I had my surgery. I had a check-in time. I was saying yesterday was 5:45 a.m. I got there plenty of time, and basically at that time there's almost nobody there except a receptionist to check you in and some of the nursing staff to get you going. But ironically, I wanted to say a little side note that was kind of funny about it. Keep in mind the orthopedic clinic that I went to actually has a surgical unit upstairs. So actually you don't have the surgery in the hospital, it's outpatient. So anyway, what happened was I got there probably about 5:20, 5:25, and the place is maybe about 1.5 miles from where I live. And when my wife and I pulled up, and I was the one driving because I figured before the surgery, what was the difference? But anyway, we had driven up, and for whatever reason, there was 3 buildings in a row, and I just assumed, and I've been there a few times, that it was building 2. And my wife and I, we got out of the car and we were going in to check in, figuring there probably wasn't much of a staff there. And we had tried to go to the 3rd floor, which it was supposedly on, and guess what? There was no 3rd floor. It was a 2-story building, and my wife and I had looked, and it's like, well, we don't see something advertising there's a surgical unit. Secondly, just as importantly, that my doctor wasn't listed on the doctors that are in that building. So the good news is I was trying to keep my wife from panicking, and I was definitely trying not to show panic on my face, to think, oh gosh, what's going to happen? Because my wife had said, well, maybe it was in one of their other 2 offices and you just misunderstood that it was here locally. And I kept thinking, no, I'm pretty sure it was here. So anyway, after a little bit of thought and a little bit of calming ourselves down, and really kind of me calming my wife down too, because at that point I'm thinking, I can't miss this surgery. I just absolutely cannot miss it. And the surgery, granted, wasn't scheduled for 5:45, but that was a check-in. The surgery actually happened at 7 o'clock. But needless to say, when we got back in the car, and my wife said, well, maybe it's building 1 or 3. And I said, well, of course, it's pitch black out. And I said, nah, it doesn't look like that. I assumed it was building 2. Well, long story short, it actually was building number 3. And when we pulled up, their bigger outside sign said, yes, orthopedic, surgery center. Then, of course, when I looked at the building, it's like, yeah, this has 3, stories. We walked in, of course, then it did advertise surgery center, floor 3, and of course my doctor was on the directory. So just kind of to let you know a little bit of what happened. It's now early evening, but like I said, I was started out being prepped for the surgery as far as checking in and everything, 5:45. Probably about 6:30 and so forth, I was done with all the information, and they called me in to be actually prepped for the surgery about 6:45. I will tell you this, it's one heck of a this orthopedic surgery center where I went to in Fort Walton Beach, Florida, just outstanding. To be honest, I realize with doctors and staff and so forth, there's good, there's terrible, and there's excellent. These people are far and above, where the good part doesn't even apply. They are excellent. From the time I started going to them a couple months ago to get ready for this, just across the board. From the receptionist at the desk to obviously the surgeon, the anesthesiologist, just excellent. The surgical nurses, excellent. So anyway, back to the surgery. So we went in about 7 a.m. And quite honestly, probably a few minutes later, I no longer was conscious, so that was a good thing. I came out of the surgery probably about 9-ish. And the doctor at that point had already talked to my wife and said the surgery went, fantastic. He had no hiccups, no problems whatsoever. And he said that the surgery went well and I was doing well. So basically at that point, then it was like I said, outpatient. So I guess their first thing is, as long as you can use the restroom, then you're good to go. And that's basically what happened. It took me a little bit. Once I was able to use the restroom, then guess what? I was discharged and set to come home. And like I said, we live about 1.5 miles, so it's probably like a 10-minute ride. Basically, my wife took me home. She said, maybe you want something to eat. So we decided. I got a couple of breakfast sandwiches at McDonald's. Here in Fort Walton Beach, we own a 2-story townhome. It was my kind of the way the setup was. It was better for me to keep my room actually in my bedroom, where we do have a bathroom upstairs as well as downstairs. But anyway, to make it more convenient for me, we decided to keep me upstairs, where I'll stay for a few days. In this way, I'm not necessarily going to do any stairs if I can help it. I'm going to stay away from that. So I just wanted to, check in with everybody and kind of let you know, I guess I'm progressing what my journey was. Things went well. I kind of got my room set up a little bit, how things are going to go for me. And so far, like I said, the good news is I'm not in a lot of pain. I also am at the point that minus, even though it didn't have to be, prescribed by the doctor, I'm on some Tylenol and some ibuprofens. Obviously, the antibiotics, which are a big part of it, and I've taken those. But the good news is, up until now, which, like I said, we're in the evening, I haven't had to take the heavy pain medication that they give me, because I'm hoping to use that as sparingly as possible. I feel like even the doctor said, yeah, you may not use all 7 days, but you may use a couple days of it. Don't let the pain get you, and your fear of taking a narcotic, don't let that get in the way of you're going to suffer really for no reason. A couple of days, his theory is you're not going to get addicted on oxycodone. I don't know. I agree with him, obviously, with that. I mean, it sounds far-fetched. In a couple of days I would, but obviously I'm just trying to be careful. I don't want to be overly medicated, especially with the harder drug. So like I said, everything is fine. It's like I said, it's in the evening, and I couldn't feel much better. Things have gone better than I thought so far, as far as the pain and how I'm adjusting to getting started with the slight exercises that they've given me, because I see actually the physical therapist outpatient on Tuesday. And today is Friday the 13th. The other good news being Friday the 13th, and I'm not superstitious, but you still have to respect Friday the 13th. And nothing crazy, kind of happened, so that's a good thing. So this is day 2 of my journey. And like I said, I hope that people will share their journey as far as surgeries with hips and knees and shoulders and elbows and everything like that with me, as well as me sharing mine with you. So when you're able to, definitely leave us some comments. The only thing I ask is let's keep the comments, for lack of a better word, let's keep them nice. I like to hear the truth, but I also like to hear truth in a nice way. So anyway, guys, it's like I said, it's in the evening. I'm unwinding after the day of my surgery. So I'm going to try to get a little bit of rest. I've been up since, I think we got up a little bit before 5. So I've been up since 5 a.m. And trying to get myself where I am kind of tired that once maybe when I do conk out, guess what? That's going to be for maybe a good chunk of the night. But anyway, I appreciate you guys listening to my video. And like I said, this is day 2 of my journey of my hip replacement. Like I said, I am going to end up having both done, but this is the start of this is my left hip replacement. So I'm going to end this by saying, guys, have a great rest of the night, and I will talk to you tomorrow. Thank you.